It's Thursday morning, which means we have Dr. Polsky on the line. Good morning, sir. How are you?
Good morning. June is looking a whole lot better than April.
Yes.
Yeah, right?
June is looking so much better than April. Yes,
man.
indeed.
Yeah, so I think the takeaway is the comment the governor made last night during his press conference. I'm sure you probably saw it. We didn't flatten the curve. We crushed it.
I think we're doing a great job.
Do you not agree with the governor?
I agree. The only thing, and I'm not getting too worried, but complacency is the only thing I think that we really need to watch out for. So we all need to keep in mind that COVID is not gone. We're still seeing cases in Calvert. I know there's still cases in St. Mary's, in Charles County. But compared to where we were 6 weeks ago, things are much, much better. What I would love to see, and what I think is doable at this point, is to get the case rate down close to zero.
Yeah, that would be great. And you think that's doable?
Where is the case rate now, like in Calvert?
So numbers are a little bit tricky because we don't have truly universal testing, and we still don't have reliable antibody tests to say how prevalent things are. But to put it in some context, as we look at multiple factors that we've been tracking, cases are probably down by about 75 to 80% from where they were about a month ago.
So,
Wow.
I mean, is it single digits? Are we there yet?
Yeah, well, and that's where it's hard for me, and I'm not trying to, kind of avoid the question.
Right.
No, it's
just
okay.
don't have enough data to be
Right.
that specific.
Okay.
So,
All right, but listen, it's way down.
Right, and what we're seeing, what we've seen in the last week in Calvert, as far as documented cases, we're down to, on average, 2 cases per day.
Okay.
2
All
cases
right.
per day.
Okay.
Okay, now what about hospitalizations in Calvert?
And that's way down as well. So again, we still have people in the hospital, and keep in mind that people who are hospitalized, oftentimes they became infected 2 or sometimes even 3 weeks prior. So that's looking back in time a little bit, not what is actively circulating in the community.
Let me back up just a minute because a few weeks ago there was a lot of talk about different medications and stuff like that, and of course it's different for every person. But is there a go-to medication that you guys look at if somebody's really in a bad way? What is it? That Remdesivir, whatever that thing is?
Yeah, so I would look at all the medications, whether it's remdesivir or some of the other therapies, and we talked a little bit about immune globulin, I think, last week. Those are still, I would put them in experimental category. We just don't have enough data to know how beneficial it is, who will benefit from it, and how early in the course of illness it needs to be used. So those are things that I think that by the time we get into fall and winter, when it's likely that the virus will start to spring back in greater that hopefully they'll have treatment regimens much better defined.
So the governor yesterday spoke again and said, hey, tomorrow evening at 5 p.m., indoor dining. Does that make it a little nervous at 50% or no? Are you confident that restaurants and folks will be able to make sure everything is clean and good?
Well, I think the 50% is just a number. That in reality, the true number is the distance between tables, and so that's going to be the limiting factor. It's not what the fire marshal code says.
Right.
And for all the restaurants that have done outdoor dining, they've kind of got the drill down by now. And for those restaurants that weren't able to do outdoor dining through our county partners, the health department, environmental health staff, we're ready to go at this point. We've already started doing outreach to help get them up and running more quickly. The key there is going to be, again, proper distance between tables, that wait staff, all the restaurant staff are still required to wear masks at all time. Diners ideally should have masks on while they're waiting. Certainly they're not going to have masks on while they're eating. And that menus will be paper menus.
So they can be just thrown out.
Correct.
Okay. What do you think, Dr. Polsky, as we've gone through this pandemic, certainly there's been a lot of societal changes. I mean, we're all walking around with masks on. What's the biggest change in the hospital as far as how you guys tackle things and how you gear up for these things?
Hospitals, and we go back to Ebola and some other, H1N1 that was about a decade ago. So hospitals continually have emergency plans. Each type of infection has its own quirks to it, so plans always get modified a little bit. I think it's really the vigilance in this case, because this virus was so easily transmitted, and making sure that hospital workers are wearing their personal protective equipment appropriately at all times, not only to protect the patients, but protect the workers themselves. And so I would say the culture of the hospital changed over the past few months. Not that people were ever lackadaisical about anything, but the vigilance, I think, reached a new height.
Well, I think because of exhaustion.
Yeah, I mean they got to be wore out.
Months after months, they have to be worn out. Now, next week, Friday at 5 p.m., I mean, some big changes are coming. I mean, everything from casinos opening, arcades, malls, the gyms can open finally. But also they're talking about school buildings. They're talking about outdoor high school sports can start up again. How far do you think we are from stage 3 to just everything open, nobody wearing a mask? Woohoo, here we go.
Or is that something that's not going to happen until they have an actual vaccine?
Well, let's pull back to stage 2 for a sec. And so, I think it's great that more people can get back to work, and that kids that have been relatively isolated and probably have been emotionally struggling can be with their friends more. They can become more physically active. I think all those things are great. I think everyone should need to keep in mind, again, that the virus is still circulating in the community at much lower rates than it was before, but it's still out there. And they still need to use good judgment for those who are older, for those who have household members who, children who unfortunately have to go through chemotherapy.
Right.
We have people who are insulin-dependent diabetics. There still needs to be a certain degree of good judgment and caution, and it shouldn't be just a free-for-all out there.
Right.
Parents on the sidelines, when their kids are at soccer games, they should still maintain reasonable distance between families. All those things are important, because if we're going to move to stage 3, we're going to need to see that those rates are down near zero. And the timeline on that, I could only guess at.
Right.
Okay. All right.
All right. Well, listen, we appreciate you calling in. I know things are progressing, and that's awesome. You got to feel some relief to see some kind of light at the end of the tunnel.
The numbers being crunched, yeah.
And that is due in no small part to the good efforts that you guys have made. And we collectively appreciate it, man. Thanks for all your hard work.
My pleasure. And I think that everybody collectively should feel some gratification, because I know everybody sacrificed.
Yeah. Well, I'm a hero. There's no question about that.
And, we would not be where we are right now if it wasn't for everyone really making good efforts and adjusting, doing things that ordinarily they would not have chosen to do,
right.
Kind of sacrificing a bit for the common good. I'll just throw out really quickly that as we head into the summer, people want to go on vacations. I would consider maybe trying to discover some new place you've never been before that isn't crowded. Find a park, find something that is away from where all the crowds are thronging in.
Yeah.
Eat out on weeknights. So you want to support your local restaurants that have been struggling. Eat out on a weeknight and not wait till the weekend.
There you go. Go out on Tuesday versus Friday. Yeah, exactly.
Right. And shop in small stores that are now allowed to open instead of again going into the big mega whatevers. And think about farmers markets. All those people who have been struggling in our community. This is a great time to support local businesses. And at the same time, in almost all those cases, you're also keeping yourself and your family a little bit safer.
So it's a win-win. You say you help out small business, you keep yourself safe, everybody wins. That's great advice.
Great advice, Doctor. Thank you so much for your time this morning. We can't thank you enough.
All right, thank you too.
All right,
guys. Take care.
All right, it's 17 minutes after 8 o'clock, 8:17. Our phone lines are open for you if you want to give us a call this morning. That is great advice. Yeah.
I never really thought about it like that.
Well, if you're going to a smaller place, obviously there's fewer people.
Right.
And you could easily see how that place has been, just beat up through this whole thing. So you give them a little bit of money, which they are going to greatly appreciate. You're a little safer in your shopping, which, your health and your immune system would appreciate. Yeah, it's a win-win. That is a win-win.
Mm-hmm.
It's a good thing. 17 minutes after 8 o'clock, 8:17. Phone lines are open for you if you want to give us a call this morning. That would be awesome.
You know, I know that the healthcare workers, I know from the very beginning, they just work so hard. But can you just constantly on guard? Just constantly. Never giving up a moment, not a moment to breathe, And finally, it is starting to, the numbers are going down, and finally you have an opportunity to breathe. I don't think it's being less vigilant. I think it's just...
Oh, no, I don't think that, no.
I think it's just an opportunity to breathe, thank goodness that they have that, because they have just been on it like crazy.
Yeah, they have been going at 1,000 miles an hour, and they've been doing it since...
March.
I don't know. Yeah,
February.
Probably. Certainly March, probably February, gearing up for it. And then, here comes this beast of a disease rolling through. And they've been fighting it tooth and nail for months now. Tough. Double tough. And, yeah, that's something that the governor should think about. Like maybe declaring someday, healthcare worker day in Maryland.
Yeah.
And, if you got a hospital ID, if you're a nurse or a doctor or anything, you work at a hospital, I don't know.
Free ice cream.
You get to park for free. I don't know. Something. Should get something, right?
Right.
Should get one day. One day?
One day.
We can't do one day? Slice of pizza? Come on.
Sure we can.
I think we probably can. 19 minutes after 8 o'clock, 8:19.